Thank you. Honorable Minister of State for Health.
Thank you very much, Mr. Chairman, other members of the Presidential Task Force on COVID-19, media representatives here present, distinguished ladies and gentlemen. As of today, the 8th of April, 2020, Nigeria has recorded 254 confirmed COVID-19 cases. Lagos remains the epicenter with 130, 50 cases in FCT, 20 in Osun, 11 in Edo, 11 in Oyo, 6 in Bauchi, 5 each in Akwa Ibom and Kaduna, 4 in Ogun, 2 each in Enugu, Ekiti, Kwara and River states, and 1 each in Benue, Delta, Katsina and Ondo states. The spike in Osun is linked to the arrival of Nigerians to that state from ECOWAS countries. Several groups of Nigerians have made similar intentions known to return. Those discharged from treatment are 44, 7 of which are from the University of Abuja Teaching Hospital Center. We unfortunately have 6 coronavirus-related fatalities in total. There are presently 204 active cases of COVID-19 in Nigeria. The Director General of NCDC will give further details in this regard. We have 9 laboratories for testing as at today for COVID-19 to be augmented over time by other laboratories in the public and private sector. The visit yesterday of the Presidential Task Force to Lagos affirmed the great work Lagos State Government is doing to enhance preparedness and response in the state. We are sure other state governors shall prepare in the same way with infection control, compliant isolation centers, and aggressive community surveillance. Lagos University Teaching Hospital commenced operation of a 60-bed isolation center 2 days ago, having received the COVID-19 starter packs and trained health workers. As the global community commemorated World Health Day yesterday, I thank our health workers for their commitment, hard work, and sacrifice in the response to this pandemic that has drastically changed the pace and style of life. Through training, provision of guidelines, and personal protective equipment, we continue to enhance the understanding and capacity of our frontline workers for this novel disease. I urge all health workers to apply infection prevention and control protocols always and maintain a high index of suspicion for COVID-19. The resources on NCDC COVID-19 website covid19.ncdc.gov.ng, including national case definition guidelines, are being constantly updated. To health workers, I say your well-being is a priority to us, and we cannot thank you enough for the work that you do in protecting the health of Nigerians. I want to strongly advise citizens against giving false information of symptoms or travel history to healthcare workers when seeking care at this critical time. It's important for me to emphasize this because we've had quite a number of cases where people deliberately chose not to reveal their travel history. And the implication is grave in terms of case management. Doing so puts the health of health professionals at risk of infection and also deprives them of comprehensive information to properly diagnose and manage illnesses. Those who tested positive for COVID-19 must report to designated treatment centers for safe isolation and care. Even if they feel well, because the danger of this disease is that those who do not have any symptoms are still as infectious as those with symptoms and need to be isolated for the sake of their families, friends, and the public at large. Health facilities, both public and private, are called upon not to reject patients without giving them advisory on what to do, but to follow NCDC guidelines and refer suspect cases to COVID-19 test sites. In all cases, essential health service is to be rendered, including emergencies, since the arrival of coronavirus does not mean disappearance of other diseases. Additionally, all health facilities are reminded that coronavirus is an extremely dangerous pathogen which spreads very easily. It is not advisable to accept persons suspected of such infection for treatment if the facility is not so accredited. What is meant in this regard is that we're not just relying on public health institutions. We have started the process of accreditation for private hospitals where we are able to establish that they have the facilities for infection prevention and control. And of course, the necessary personnel are on ground. Health workers and other patients and visitors will otherwise be put at great risk. We're engaging the Association of General and Private Medical Practitioners of Nigeria and the Guild of Medical Directors to adequately so when you read from some of these devices and you have a number coming in to disrupt, that's why at times the hard copy would be a better thing to do. But then, the health sector must not lose the gains we have made in the last few years as we combat COVID-19. But continue to support our health workers at all levels. I must highlight the generosity of individuals, groups, corporate organizations, public and private, who have made donations and offered support in various ways to the national response. Donors include health sector associations like the Pharmaceutical Association of Nigeria, JUHESU, and both Nigerian and foreign businesses, civil society, organizations, bilateral and multilateral partners, and foreign governments. Thank you very much.